Hi, everybody. Good morning. Welcome to Today. It's Wednesday morning, and we're glad to have you along with us.
We certainly are. We'll begin with some sobering new information on the coronavirus pandemic. The head of the UN just this morning describing it as the worst global crisis since World War II.
And it's hard to argue with that when you look at some of these numbers. Here at home, the nation's top doctors are now estimating that even with strict social distancing measures in place, in the best case scenario, as many as 240,000 Americans could die from COVID-19.
As of this morning, the number stands at nearly 4,000, with 188,000 cases overall. Now, compare that to just 1 month ago when there were 2 deaths and just 89 cases here in the U.S.
In the meantime, New York City has passed another terrible milestone, more than 1,000 coronavirus deaths in less than 3 weeks.
And a newly approved test for the virus that can deliver results in as little as 5 minutes, well, that begins shipping today. The head of the FDA has called this a game changer in the fight.
Our team is in position covering every angle this morning. Let's start with NBC's Tom Costello. Tom, good morning to you.
Good morning. The message from the CDC and the White House to Main Street USA: be prepared. As you mentioned, in a best case scenario, this country could see as many as 240,000 people die as a result of this pandemic. And if the country does not engage in social distancing and isolation, that death toll could be in the millions. President Trump, with top public health experts delivering a grim forecast for the coronavirus pandemic now gripping the country.
I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. This is going to be a very painful, very painful 2 weeks.
The White House displaying this stunning slide, showing even if current social distancing guidelines are maintained, the White House projects 100,000 to 240,000 deaths in the U.S. over the next several months, a casualty rate that would eclipse the number of American lives lost in the Vietnam War.
As sobering a number as that is, we should be prepared for it.
The new data showing the current pace of the epidemic spread in the U.S., the epicenter of New York, illustrated in this steep curve. The president singling out the governors of New York and New Jersey.
For whatever reason, New York got off to a very late start. And you see what happens when you get off to a late start. New Jersey got off to, and I think both governors are doing an excellent job, but they got off to a very late start.
A spokesperson for New York Governor Cuomo responding, "This is not the time to debate," but the states were not slow to respond. The federal government was absent. The alarming forecast prompting the president to extend those social distancing guidelines until the end of April, backing off his comments from last week when he said he hoped the country would reopen for business by Easter. Even with 3/4 of Americans subject to stay-at-home orders in their states, more than a dozen governors, many in the South and the West, have declined to issue those orders statewide. Overnight, during an NBC News special, Savannah asked Dr. Anthony Fauci if enough is being done to keep the death rate down.
Is the social distancing that's being done right now in every state enough for that scenario to occur?
The mitigation and social distancing clearly works. We need to put our foot on the accelerator and not on the brake. We have 30 days of the extension of the mitigation, the guidelines. We need to really push.
A point also echoed earlier by Dr. Deborah Birx.
There's no magic bullet. There's no magic vaccine or therapy. It's just behaviors.
A quick note on the economy, because nationwide, stores like this one here at Pike and Rose, the stores are closed down in Maryland, as in much of the country. Restaurants, they're trying to offer takeout service to keep their businesses going. But listen to this stat about air travel. On a typical day before this pandemic, we would have 2.5 million people traveling on a typical day in the air. On Monday, there were fewer than 200,000. The economy has just absolutely hit a wall. Savannah, back to you.
Yes, it has, and no end in sight for the moment, Tom. Thank you very much.
Now to the dire situation that's only growing worse by the day here in New York. With cases still surging, healthcare workers on the front lines are being pushed to the brink. NBC's Gabe Gutierrez is near the emergency field hospital that's being set up right nearby in Central Park. Hey, Gabe, good morning.
Hoda, good morning. These medical tents behind me are a stark reminder of the growing emergency here. In New York City alone, more than 1,000 deaths now and more than 43,000 confirmed cases. And Governor Cuomo doesn't expect the peak here for up to 3 weeks.
This morning, to fight the war, New York City is getting some much-needed reinforcements. FEMA rushing 250 ambulances from around the country. First responders and nurses already swooping in by the thousands.
We're here for them. We're here for New Yorkers.
Tim Boger is working at the new field hospital in Central Park.
We have 68 beds here. We have 10 ventilator beds. So I imagine that's a high need right now.
After spot shortages of protective gear, New York City's mayor says help is on the way.
We are distributing 3 million surgical masks all over New York City to our hospitals.
But in and around the city, frontline healthcare workers are exhausted from taking care of a skyrocketing number of patients.
Feels like playing dominoes every single minute over 10 hours straight, feeling like any one of your patients is about to fall.
Also exhausting protecting themselves from getting sick too.
It is so hot under all this PPE, but it's important that I keep myself protected.
Sheena Tanis is a critical care nurse at a Brooklyn hospital.
I look like I've aged 20 years in 2 weeks.
She looks over some of the sickest COVID-19 patients on the overnight shift.
This is too much. I don't know how much longer I could do this.
On the semi-deserted streets of the city, there are also fewer first responders. 15% of the NYPD called out sick Tuesday. More than 1,000 cops have contracted the virus, so have about 300 firefighters.
This virus is the great equalizer.
And it's now hit home for New York Governor Andrew Cuomo.
I tested positive. Scary. Yes, as you might imagine.
His brother, CNN anchor Chris Cuomo, has tested positive.
Now, he is going to be fine. He's young, in good shape, strong, not as strong as he thinks, but he will be fine.
But so many other families are anxiously waiting for word while their loved ones are in hospitals. But Savannah and Hoda, another sobering milestone. The number of confirmed cases here in New York State has just surpassed that of China's Hubei province, where the pandemic started.
Wow.
Back to you.
Staggering numbers there. All right, Gabe, thank you.
Let's turn now to our medical correspondent, Dr. John Torres, and NBC News contributor, Dr. Joseph Fair, an expert on the study of viruses, who was on the front lines of the fight against Ebola in Africa. Doctors, good morning. I will start with you, Dr. Fair, this morning, because a lot of people were stunned to see this projection from the White House that estimates 100 to 200,000 people, Americans, could die, and that is if everything goes right. If social distancing is executed exquisitely in all 50 states. Is that happening right now?
Absolutely not. I mean, when you see on the map of states with full state lockdowns, and then you see the map with partial state lockdowns, and then you see the states with no lockdowns, until all 50 states do it, and they all do it at the same time, it's really kind of a moot point. As we talked about, those are best case scenarios with everyone doing the same thing. That's only going to happen if all 50 states are doing the same thing. That's why I'd really urge, the Association of Governors to get together, everybody get on the same page as far as what they're going to do, and everybody implement the same measures strictly across the states.
The other question I had is, and I think we just put the chart up there, and it shows the big peak that we're trying to avoid and then the flattening of the curve that we're hoping for. It's suggesting, okay, we can keep that curve low, keep those deaths hovering around 100 to 200,000, staggering that we're even talking in those terms. But nevertheless, does the social distancing, if it ends on April 30th, as is the current scenario, would that be enough? Or in all reality, does social distancing need to go on for longer?
Realistically, I think it's going to have to go on for 6 to even 10 weeks. And again, it goes back to...
Total or from now?
Yeah, absolutely. And that's if everyone starts today, right? And so, again, it goes back to if everyone's not doing it, there are still going to be people out there spreading it. There are things we're going to have to do. We have to go to the grocery store. We have to go to the pharmacy. There are people that are working in hospitals, et cetera. But we can all do our own part, and everybody has to do it. And frankly, I even think we need to get the police involved in it, just as far as implementing strict distancing measures. If you see people crowded together, have them start breaking it up.
Wow. Okay, that was pretty riveting. Dr. Torres, let's talk to you. Yesterday at the news conference, the president talked about maybe Americans should wear some kind of mask or bandana. He said, don't use the masks that the health professionals use. What do you think about regular, everyday Americans getting some type of face covering during this time?
Really important.
And what you're hearing here are two sides to this debate. One side are the CDC and World Health Organization saying that the general public doesn't really need to use them and probably shouldn't use them. With the other side, you're hearing from the president, in fact, saying, let's wear scarves and it doesn't hurt people to use those. Last night on the special that you guys hosted, Dr. Fauci actually said something pretty interesting. I think it's good to bring up. Those masks, what they're looking at doing is telling people to wear those masks because they protect people who are sick or who might have it and are asymptomatic from spreading it to other people. They're not looking at it as far as people protecting themselves from getting it. And so I think that's a big thing to understand. And they're looking at it very heavily right now. And my guess is at some point they're going to go ahead and make a recommendation that people do wear things like that, but save the surgical masks, save the N95 masks for the healthcare workers and the frontline workers because they need them. But as far as the other ones, the World Health Organization has said there are some studies saying that they might make things a little worse and more likely to catch the virus because people get a false sense of security and they get within that 6-foot perimeter that we want to keep away from each other. But at the same time, they could offer a little bit of protection.
And Dr. Torres, a lot of my friends have been talking about this. They're afraid to go to the grocery store, the drugstore. They're wondering how contagious is this? Are they putting themselves at risk when they leave their home and go out, even for a short period of time?
So anytime you leave your house and you go outside, there could be people out there that are either sick or they're asymptomatic. They don't have the symptoms, but they do carry the virus. And so getting that 6-foot distance is important. If you go to the grocery store, if you go shopping, it's going to be hard to do that. And so you are putting yourself at a little bit of risk every time you go out and do something like that. And that's why we say, number one, if you're out and about, make sure you keep as good as you can that 6-foot distance. And when you get back home, wash your hands, especially before you touch your face. And that's kind of the best you can do because there are some instances you're going to need to go out and there are some things you're going to need to do. But at the same time, you want to make sure you protect yourself as best you can because it is adding a little bit of risk every time you get out there.
All right, Dr. Torres, Dr. Fair, thank you as always. It's good to have you with us. And get that soap lathered up and really scrub them. I've been having to go over it with my kids and even remind myself. Scrub under the fingernails and in between.
Right. And when you don't, we got this right here, too. Taking care of business.
Yes,
all right. Also breaking overnight, another escalating situation tied to the outbreak after dozens of crew members tested positive on a U.S. Navy aircraft carrier. Their captain now making a desperate plea for help. NBC national correspondent Miguel Almaguer has the very latest on this story. Hey, Miguel, good morning.
Hoda, good morning. The captain of that nuclear aircraft carrier says many of his crew members are sick, and he's pleading with the Navy to put them into isolation, a situation he says is quickly deteriorating.
The commander of a Navy aircraft carrier docked in Guam, giving a dire warning about dozens of servicemen aboard diagnosed with the coronavirus. According to a letter obtained by the San Francisco Chronicle, the captain of the USS Theodore Roosevelt telling Navy leaders the spread of the illness is ongoing and accelerating, and that removing all but 10% of the crew is a necessary risk in order to stop the spread of the virus. We are not at war. Sailors do not need to die. If we do not act now, we are failing to properly take care of our most trusted asset, our sailors. Captain Crozier writing that only a small number of infected sailors have been taken off the ship and that following official guidelines for a 14-day quarantine and social distancing in such tight quarters is impossible, saying, due to a warship's inherent limitations of space, we are not doing this. The captain forced to ask for compliant quarantine rooms on shore in Guam for his entire crew as soon as possible. Yet, despite those limitations, Defense Secretary Mark Esper telling CBS News it is not time to evacuate the vessel.
At this point, make sure that we contain the virus, that we deploy testing kits so we get a good assessment of how much of the crew is infected.
Acting Navy Secretary Thomas Moodley stressing to MSNBC that the carrier must remain operational.
But we're doing everything we can to ensure that the ship maintains a level of readiness that in case there is something that happens, it can be ready to go.
This morning, a wartime ship doing battle with the virus, threatening us all.
The scare on the USS Theodore comes after hundreds of passengers have gotten sick and some have even died on cruise ships. Of course, the big concern is, like on a cruise ship, on the USS Theodore, those tight quarters certainly can spread the virus. Guys, back to you.
All right, Miguel, thank you.
All right, what say you? We should do the weather, should we?
Like it.
I'm moving. All the words are going in different order now. That's what's happening to me. Mr. Roker, good morning. Morning,
well,
good.
Good to see you two, it is.
Yes, I'm like Yoda.
Well,
Did someone say Yoda? Oh, okay.
That's right. Yoda, oh yeah. These are not the droids you're looking for, but let's see. This is not the storm you're looking for. We got a big storm system off the New England coast. It is going to start to intensify the mid-Atlantic coast, I should say. A lot of wet weather along the Carolinas. We're going to watch this thing with 60-mile-per-hour wind gust in the Outer Banks. Coastal flooding from Maryland on into North Carolina. Tomorrow, that heavy rain moves into New England. Gusts of up to 50 miles per hour. Cape Cod and the islands. Heaviest rain is going to be right along the New England coastline. And out west, we've got a big storm system coming in, bringing rain and snow into the Pacific Northwest and the Cascades, with snowfall amounts anywhere from 6 to 12 inches of snow.